Well, another big announcement in the Hoosier healthcare sector this week. This one from Central Indiana and Community Health Network. Community unveiling a new partnership with VillageMD, a Chicago-based company focused on primary care. Barbara Lewis has more on the creation of a new company in the business of health. Barb.
Gary, thank you very much. Well, the new entity is called Primaria Health, and the goal is to allow primary care doctors in 38 Indiana counties to focus on the patient rather than paperwork, and to intervene early enough to prevent health problems rather than just treat things like diabetes after they develop. So joining me to talk about this new partnership is Primaria Health CEO Doug Stratton and VillageMD CEO Tim Berry. It's good to have you both on.
Thank you.
Thanks for having us.
First question to you, Doug. Why this partnership?
Well, the evidence is abundant, and we've known it for a long time. There are issues with the healthcare system today that are simply gotten to the point that we usually refer to it as an unsustainable system. The efforts by Community Health Network and then in partnership with VillageMD is to make some sense out of what our assets are, what our resources are, and how can we bring those to the market and to patients in particular in such a fashion that we change the care model. We know that we're extremely good at recovery, resuscitation, dealing with problems once they develop. The problem that we're trying to solve for is how do you get ahead of that curve? How do you begin the process of developing a system that takes care of problems before they come? It's a complicated system. There are many, many moving parts to it, lots of aspects and dynamics. But this concept of Primaria Health addresses some of the most fundamental of those, and that is primary care. How is it that we can develop a model that will allow us to get the care to the patients needed at the earliest opportunity?
And Tim, the model itself, I mean, how does it affect the patient? How does it save money?
So the core aspects of the model are fundamentally that Primaria Health is a services organization. The services organization is partnering with Community Health Network and the 300 plus primary care providers that community employs today. The model is also about reaching out to several hundred independent primary care providers across this marketplace who today, whether they be at community or whether they be out in independent private practice, they're trying to stamp out disease every single day in the best manner they possibly can through 15-minute increments. And this model says, let's think about moving away from just reacting to disease, as Doug talked about, and really looking at data and looking at analytical insights and being able to say there's a very small portion of every single physician's population of patients that are accountable for a huge amount of the total medical spend. And if we're going to have an impact that drives value for employers, for patients, for the government, we have to have a solution that brings resources and people and social workers and all kinds of proactive activity for these primary care providers so that they can better optimize the care they provide to their patients.
So the savings comes from just keeping people out of the hospital, if you will, or just prevention more than treatment.
The savings come from being able to identify patients today who are navigating the healthcare system on their own, and because they're physicians who are all trying to provide the best possible care for them, they today, because of the fee-for-service healthcare system, don't have the opportunity to do all they possibly can for each of their patients. And so when the patient is left to navigate the system on their own, they're not aware that sometimes their medication isn't working for them, or certain aspects of their home environment might be getting in the way from them being able to follow the plan of care that their doctor has laid out for them. And so it's really about saying, how do we engage them very early on? And through a better overall clinical model, part of what will happen is people will need to go to the hospital less. Those who are admitted to the hospital, the level of readmissions will go down pretty dramatically because we're better coordinating and connecting the care across hospital to the primary care doctor, to the family, to the patient.
Well, Tim Berry, Doug Stratton, thank you both, and we'll have you on coming months and see how it all goes.
Thank you very much.
Thank you.
Gary, back to you.